Hello guys, today we will discuss about the ischemic stroke and the hemorrhagic stroke, which are a type of disorder which affect the brain. First one is the acute stroke. Acute stroke is the focal and global impairment of the brain function which is resulting from the pathological process. It can be affected by the thrombus, embolus, there can be the vessel rupture of the blood vessels. And if we talk about its etiology, in order to decreasing frequency, there can be the ischemia, which is the 80%, and there can be the intracerebral and intraventricular hemorrhage, which cause the 15% of cases, and subarachnoid hemorrhage, which is the 5%. Stroke can be divided in the three subtypes: ischemic stroke, hemorrhagic stroke, and subarachnoid stroke. Where can be the V? Here is the diagram which is represent are the circle of Willis, which are the main artery coagulation systems which affect our body to the supply of the arteries. Here can be the many arteries which supply to our brain. There can be the anterior cerebral artery, middle cerebral artery, posterior communicating artery, posterior cerebral artery, and main branch of this artery which is divided to the basilar artery, and internal carotid artery which supply the internal part of the brain. First is the ischemic stroke. There can be the differ from a stroke which is the transition stroke. It's a symptom and sign resolved to the completely within the 24 hours. The vast majority of the transient ischemic stroke with 1 hour, and only the 5% last longer than the 12 hour. Patients with the crescendo transient ischemic stroke have a high risk of the development of the complete stroke, which can cause the neurological deficit that are the either minor or the major, accelerating and fluctuating or the progressing the course of the stroke that can be development is the uncommon. If we talk about its etiology factor, it can be the by the embolism, where the 70% of cases can be affected, and emboli are arise from the local erythematous lesion on the wall of the large artery, which is the macroangiopathy of the brain or the heart vessels. There can be the cardiac embolism in the arterial fibrillation, valvular heart disease, ventricular thrombus, and the myxoma. Where can the embolism can be the deposition of the fibrous protein to the earth brain, which is called the emboli. And second most common is the thrombosis, which is the main etiology is the 25% of chance to the patient. And there can be the occlusion of the small end arteries, which is the microangiopathy we can call, and causes of the lacunar infarction. The cause of the hyaline or the proximal sclerosis of the penetrating arteries, and there can be the causal factor if we include the hypertension, diabetes, blood brain barrier disruption leading to deposition of the plasma protein. Where can this plasma protein is deposited to the arterial wall, and microangiopathy related to the hemodynamic change sometimes cause the hemodynamic infarction. There can be the rare cause which are the 5% cause of these stroke. There can be the include the hematological disease like abnormal blood viscosity, anemia, leukemia, and coagulopathy. If we talk about the arterial process, there can be the dissection, vasculitis, migraine, fibromuscular dysplasia, vasospasm, amyloid angiopathy, and there can be the cerebral autosomal dominant arteriopathy with the subcortical infarct and leukoencephalopathy. If we talk about its diagnosis, there can be the sign and symptom of the stroke are usually not specific enough to the enable identification of its etiology without the further diagnosis study. There can be we use the CT, MRI, cerebrovascular ultrasound, ECG, laboratory testing are usually needed. According to the clinical symptom by the definition for more than 24 hours and often permanent through the partial recovery is can be common. The duration of the symptom and signs seem to be the correlated with the etiology of the stroke. Here can be the some images which is the clarify the CT scan of the brain tissue damaged by the stroke, and then the CT scan is showing the brain tissue damage and in the front of the head, and there can be the damaged brain tissue can be highlighted here. And second diagnosis can be by the cerebral angiogram. We find the showing the carotid artery aneurysm, which is associated with the stroke. If we talk about its sign and symptom, here is the chart diagram. We can be clarify these symptoms. First is the dry eyes, and there can be the retinal vasculopathy, and cataract can be seen in 90% cases, and capillary artery thrombosis, anterior segmental defect also. Some type of a liver disease can be associated with it, and there can be the kidney disease cyst also can be development by the enzyme deficiency, and other genetical disorder can be associated. And there can be the stroke can be the symptom can be the hair loss of the because of the protein deposition to the brain, and there can be the arrhythmia can be developed some type of cases, and hematological features also like inflammation, hemolytic anemia, where there can be the RBC ruptures, and because of these there can be the total cell line will be decreased. And there can be the Raynaud symptoms can be seen according to skin lesion, and spleen sign can be the affected. There can be the risk factor also. First is the arterial hypertension, where the systolic pressure which increase more than 140 and the diastolic pressure more than increase by the 90. Second most common risk factor, which is the diabetes mellitus. Many cases we have seen the diabetes mellitus is the most common risk factor. And heart disease are people who smoke the cigarette, people who have the high lipid protein content in their diet. If there can be the lipid profile will be increased, and then can be the increase the elevated plasma fibrinogen, obesity, symptomatic and asymptomatic carotid artery stenosis. There can be a chance of the elevated plasma homocysteine level and erythrocytosis. If we talk about the treatment, there can be the emergency intravenous medication we can be used. Therapy with the drugs that can break up the clot to be given within the 4 to 5 hours from when the symptom first started. If we given quickly into intravenous, the sooner these drug change we are given, the better result. The quick treatment not only improve your change for the survival but also may reduce the complication of this disease. And the injection of the recommended tissue plasminogen activators, also the called atiplate and tenecteplase. It is the gold standard treatment of the ischemic stroke, and injection of the TPA is usually given through the vein. In the emergency endovascular process, doctors sometimes treat ischemic stroke directly inside the blocked vessels, and there can the endovascular therapy has been shown in the significantly improve outcome and reduce the long-term disability after the ischemic stroke. If we talk about the medication delivery directly to the brain, there can be the insert a long thin tube through an artery of groin and thread into the brain delivered by the TPA, and directly where the stroke is happening. The time window of this treatment somehow longer than for the injection and TPA, but this is the still limited. Third most common treatment, which is the removing of the clot with the stent retriever. Doctor can use the device attached to the catheter to directly remove the clot from the blocked blood vessels in the brain. This procedure is particularly beneficial for the people with the large clot can't be completely dissolved by the TPA. This procedure is often performed in combination with the injection of the TPA. Primary prevention can be involved the therapeutical modification, elimination of the risk factor, and there can be the stenosis are given the antiplatelet therapy, which is consist aspirin, dipyrimidine combination, clopidogrel. An acute treatment is based on the existence of the 3 to 6 hours of interval between the onset of the ischemia and the occurrence of the maximum irreversible tissue damage. Second most type of common, if we discuss about the hemorrhagic stroke, which is the most common seen in the patient. So nowadays the hemorrhagic stroke can be the non-traumatic intracerebral hemorrhagic, usually cause an acute neurological deficit that persists the thereafter, and it deficit the oration of the initial hemorrhage that cause the either recurrent hemorrhage and the complication of initial hemorrhage, which can be induced by the like a cerebral edema, electrolyte imbalance, heart disease. It have some type hemorrhagic stroke, which is include the epidural, subdural, subarachnoid, intraparenchymal or intraventricular. If we talk about its etiology, that how can we it is spread, if we trust eye when the trusted source of the blood vessels burst and the causing of the bleeding in the brain. As the blood presence on the blood cells, it can damage them. This can lead to the some type of neurological symptom to the patient. There are a different type of a hemorrhagic stroke. An intracerebral hemorrhagic is the most common type. In this, bleeding occur inside the brain. In a subarachnoid hemorrhage, bleeding occurs between the brain and the membrane that cover it. And if we talk about its risk factor, there can be the many type of risk factor according to it. There can be first is the high blood pressure, high level of LDL cholesterol, which is the good cholesterol. So in this condition, LDL cholesterol have a low density, and there can be the smoking and diabetes, genetical factor, family history, history of the heart disease, cardiovascular disease, a previous brain aneurysm, experience of the viral infection that caused inflammation such as the rheumatoid arthritis. These are the main risk factors. And there can be the risk factor of the specific to the hemorrhagic stroke, which are the intracerebral hemorrhagic that can include the blood vessels and not forming the correctly in the brain, known as the cerebral cavernous malfunction. It can be having a bleeding disorder and experience and the head injury and such like a physical trauma. In this condition, blood thinning medication can be used and bulge of the wall of blood vessels called a cerebral aneurysm. If we talk about its symptom can be affect the mainly the face, arm, and speech motility, and there can be the time. And if we talk about the sudden severe headache can be seen in this patient, vision change, loss of balance, coordination, become to the unable to move, numbness, weakness of the one side of the body, which is called the hemiplegia. And if we talk about its complication, blood clot that may lead to the deep vein thrombosis and possibly a pulmonary embolism. Muscle weakness, inability to move, patient feels some type of dysphagia, difficulty to swelling, memory loss, thinking difficulty, loss of vision, hearing, sense of touch. If we talk about its treatment, now the treatment is the immediate treatment for the hemorrhagic stroke is essential because it's the life-threatening condition. So emergency treatment focus on the controlling the bleeding and reduce the pressure on the brain because the high pressure can burst the blood vessels. Surgery known as the craniotomy may be necessary trusted source. A surgeon will open a small section of the skull to prevent the further bleeding. They may lead to the they may need to repair the blood vessels and seal an aneurysm. If we talk about the third topic, which is the subarachnoid stroke. In the subarachnoid stroke, there can be the head trauma is the most common cause of this type of stroke. In the patient without the head trauma, there can be the most commonly caused by the brain aneurysm. A brain aneurysm is the ballooning of an artery and in the brain that can cause the rupture and bleed into the space between the brain and the skull. Risk factor for developing an aneurysm can be include the high pressure and can be the smoking cigarette, excessive alcohol consumption, there can be the drugs, cocaine use, family history of the brain aneurysm, there can be the genetical condition, certain type of the connective tissue disorder, and prior to the brain aneurysm by the patient. There can be some symptom like sudden worst headache of the life, associated neck and back pain, nausea, vomiting, decrease the responsiveness, sudden weakness, dizziness. Sometimes patient can develop the seizure also. If we talk about its diagnosis, it can be mainly done by the computed tomography, which is the CT scan, which is the effective way to see the subarachnoid hemorrhage. Another type of CT angiography to visualize the blood vessels using a contrast medium material which is the injected intravenously. Sometimes a CT scan may miss a very small subarachnoid hemorrhage or one that has occurred a week two ago. Other tests may be ordered to detect the subarachnoid like lumbar puncture. A small needle is splashed through the lowest part of the back and obtain the cerebrospinal fluid. The fluid that part of our brain and the spinal cord, the fluid is tested for the subarachnoid hemorrhage. Second most common diagnosis instrumental which is include the MRI. This imaging test can show if there is have been the subacute blood and the bleeding in the brain, and the hospital can care following the diagnosis of arachnoid hemorrhage, focus on the both discovering and treating cause of the subarachnoid hemorrhage as well as the managing its complication. Securing a brain aneurysm, there are the several ways to treat the brain aneurysm, including the open surgery or the endovascular treatment. If we talk about its endovascular treatment of aneurysm is minimally invasive option using the cerebral angiography to access the aneurysm. There can be the characteristic of the aneurysm and the overall health of the patient. We should surgically team will discuss these options with the recommendation of which treatment is the best. Then we have to do this. Thank you for your attention.